And today we're jumping into a deep dive on a dense policy document aligned with the World Health Organization that tackles exactly this problem. The mission here is to figure out how to build dietary regulations that actually work, kind of moving past that illusion of pure individual willpower.
And it's a vital read, because it fundamentally shifts the burden.
Yeah.
We so often treat diet as this isolated success or failure of self-control. But this WHO framework analyzes human nutrition more like a complex macroeconomic system.
So let's run with that economic model for a second. The WHO outlines 4 foundational principles, right? Adequacy, balance, moderation, and diversity. But rather than just defaulting to that old calories in, calories out thing, think of your body as a high-frequency trading firm.
I like that analogy.
Yeah, so adequacy and diversity means securing a highly diversified portfolio of micronutrients and bioactive compounds. And, those bioactives aren't just your basic vitamins. They're compounds like polyphenols that physically interact with your gut microbiome.
To upregulate your body's anti-inflammatory pathways.
Exactly.
Right. And that is exactly where the moderation and balance principles come into play, specifically regarding your biological acid allocation. The hard numbers in the source demand a minimum daily input of 400 grams of fruits and vegetables just to keep those pathways functioning.
400 grams of.
Yeah. But more critically, it's about shifting the type of assets you hold. Like capping total fat at 30% of your energy intake and aggressively trading saturated fats for polyunsaturated fats.
Wait, but why that specific trade? Polyunsaturated fats always get pushed in nutritional guidelines, but what's the actual, mechanical advantage there?
So it comes down to cellular membrane fluidity. Saturated fats have these very straight molecular chains.
Okay, so they pack tightly together.
Exactly. They pack tightly and make your cell membranes really rigid. Polyunsaturated fats, on the other hand, have kinks in their molecular chains.
Oh, interesting.
Yeah, so incorporating them makes your cellular membranes way more flexible, and that actively improves the function of LDL receptors.
The ones dealing with cholesterol.
Right. Those receptors can then more efficiently pull the bad cholesterol out of your bloodstream, which mechanically lowers your cardiovascular risk.
Okay, that makes perfect biological sense. But if we know the optimal cellular asset allocation, eat the 400 grams of produce, swap the rigid fats for flexible ones, isn't the solution just doing it?
You mean just individual action?
Yeah, like basic meal prep or just avoiding the ultra-processed snack aisle entirely. Or maybe even relying on early life habit formation, like breastfeeding, to set a good baseline. It still just sounds like a personal execution problem.
And see, that assumes the market is fair.
Is it not?
Not according to the data in this framework. It shows our food environment is essentially a rigged market. Individual behavioral strategies usually fail over the long term because willpower is a finite cognitive resource.
Ah, right. You eventually just run out of it.
Exactly. If your neighborhood is flooded with highly accessible, heavily marketed, ultra-processed food that costs a fraction of fresh produce,
you're operating in an environment designed to make you fail.
You are. Education really doesn't stand a chance against an engineered monopoly.
Yeah, that makes sense.
Mm-hmm.
So converting these transient, temporary diets into sustained population health requires macro-level fiscal policies.
Yes, you have to change the environment to change the default behavior.
So we're talking about direct market interventions then, like taxes on sugar-sweetened beverages.
Absolutely. It's about internalizing the long-term healthcare costs of those products right into their upfront price. The framework also pushes for mandatory front-of-pack labeling.
To force nutritional transparency.
Right, so consumers can accurately price the biological risk of a product at a quick glance.
Yeah.
Oh, and strict limits on marketing unhealthy foods to children.
So sustainable health, really, is about aligning the entire supply chain. It's not enough to just monitor your own cellular intake. Public policies and community monitoring have to make sure the biological healthy choice is also, the cheapest and most culturally integrated choice available.
Exactly. We cannot out-diet a broken food system. The micro behavior and the macro policy, they have to work together.
Which brings us to our final thought for you. Since we know our physical environments dictate our consumption far more heavily than raw willpower,